Let me give you people gist, right? Gist, very interesting gist about this topic. There's this woman, let's call her Nkechi. She went to the clinic recently. She has not been seeing her period in a few months, and then she's beginning to be afraid because her face is breaking out with pimples. It's looking like she just started puberty again. You notice that she's starting to grow hair under her chin, around her jaw, around her neck. She's gaining weight, even though her diet and her lifestyle has not changed. Obviously, Nkechi is very worried. You can see the fear in her face. Fear they catch up. And she has gone online to search for answers. Instead of talking to our doc, she has gone to Google and she has now started typing things like, am I pregnant? Is this early menopause? Could it be cancer? But when her doctors actually sat down, ran some tests, did a scan, they noticed something that is inside her ovaries called Polycystic Ovarian Syndrome, which many people call PCOS. The moment she heard PCOS, she started panicking. So there's cyst inside my ovary. Because somebody has really told her that once you hear cyst, it means that something is growing inside you, and that something that's growing inside you is something dangerous, which means that they will do surgery to remove that something dangerous. You might not be able to have children, blah, 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 blah. What is the true story? Because as soon as I heard this Nkechi's story, she's the one that told me by herself, I realized something. A lot of people don't really understand what PCOS is about. And more people even confuse it with what we call ovarian cyst. So today, I'm going to explain both of them. We'll go step by step to understand what PCOS is. We'll also go step by step to understand what ovarian cyst is. So that everybody, Emeka, Nkechi, Papa, Mama, Pikin, will understand what I'm talking about. After this video, I don't want to hear any more questions. But the questions you have first, before I even start, put it in the comment section. But I've forgotten about you people. Yes, I know that now people are watching it from different parts of the world. Please tell me where you're watching it from so I will know what kind of content to actually create for you, whether it's from Ghana, from Akwa Ibom, from Cross River, from Congo, from Kenya, Nairobi. If I don't mention your own, please put it down there. But before we go on, let's ask some questions. First of all, how many ovaries does a woman have? Don't cheat, don't Google it. There's no wrong or right answer. Yes, there's wrong or right answer, but we're not going to judge you for your wrong answers. Is it 1? Is it 2? Is it 4? Is it 8? Put your answer in the comments. Secondly, before we enter the matter, what is PCOS? PCOS is a short form for Polycystic Ovarian Syndrome. It's a condition that happens when there's a problem with the hormones. What they used to teach us then is that a hormone is something that is secreted in one part of the body that can affect another part of the body. But we've also learned that sometimes hormone can be secreted in one part of the body, can affect even the same part of the body that is secreted from. But just call them chemical messengers. Their job is just to send message. So your brain can secrete a hormone, it goes to another part of your body. Your ovaries can secrete a hormone, it goes to another part of the body, affects things. There's something above your kidneys that can secrete hormone. Just know that hormone is the way the body sends messages with chemicals. Yes, so there's chemical in your body also. Now, in a healthy woman, hormones can control certain things like when your period comes, when your eggs are released from the ovaries, how your skin behaves, how your hair behaves. But with PCOS, the body starts producing more of a hormone that we call androgens. Androgens is what the male hormone, right? And even though some women produce it in small amounts, the same way men also produce some female hormones, women also produce some male hormones, but they produce it in small amounts. But if you're looking at women with PCOS, the hormone, which is the male androgen, probably becomes a little bit too high. And when these hormones are beginning to rise in level, you start to notice things like period becomes irregular. So if somebody, normally you're supposed to see your period every cycle. For some people, 2 cycles they've not seen, 3 cycles they've not seen. Some people, their period just stop altogether. Some people start to have trouble releasing eggs regularly, which makes it harder to get pregnant, right? Which is sometimes one of the reasons why so many women get diagnosed with PCOS. They are living fine. There are some symptoms that they don't even recognize, but then when they now try to get pregnant, they notice there's a bit of a problem. Yes. Another thing that I've also noticed is that their skin may start to break out. Pimples, acne, you start to notice it. Some people start to notice hair growing in places like their chin, their chest, their stomach. And some of us, ignorantly, when we were growing up, once you start to see women with chin hair, chest hair, you say, that woman is very wicked. It's because she's wicked, that's why she's growing hair there. That's not true. That woman might be dealing with what we call PCOS. But ignorance will not let you agree that you were ignorant at that particular point. Sometimes in other women, they might suffer hair loss. So it can go both ways. Some people also start to gain weight, especially around the belly area. Yes, abdominal obesity can also be a symptom. Now, over time, if it's not managed properly, PCOS can increase a person's chances of getting either diabetes or heart disease. Let's now answer the question, what causes PCOS? Before I start, let me first tell you that on our behalf, we have been doing a lot of work behind the scenes. There's been a lot of research that's going into this, but there has not been any pinpoint thing that we can say, this is the primary thing that causes PCOS, right? But there are some things that we've learned, and I'm going to tell you those things that we've learned. Some things can increase your chances of getting PCOS. Number one, if your mother, your sister has PCOS, there's a higher chance that you are likely to have it too. So family history also very important. Number two, if your body does not use insulin well, it can lead to higher levels of that androgen that we mentioned in the beginning. If you have not watched it, please go back. Before that starts the video from the middle, fast forward to this place, go back and look at where we talked about androgens. I'm not going to go back to it again. Now, insulin resistance. If your body is not using insulin well, it can cause those high androgen levels. Number three, if you're a bit overweight. Yes, if you're overweight, it can worsen your symptoms of PCOS. If you're even having inflammation in the body, it can also play a role in developing PCOS. Now, let's start talking about the difference between the two. If you're talking about PCOS, you're looking at small fluid fields that they call follicles. They are called follicles. These ones are not dangerous. They are not. How do I separate it from saying it's not a cyst in the word cyst? It's like, different eggs at different stages of development that have been halted in one way or the other, right? So PCOS, which is on this side, is a hormonal disorder, right? Is not the same thing as ovarian cysts. Ovarian cyst is sometimes the ovaries might be functioning well or not. It does not have almost all these symptoms that we're talking about, but you can actually find sacs that are beginning to grow in the ovaries, not necessarily the follicles themselves, right? It can grow inside, on top the ovary, within, but it's different from PCOS. PCOS, small follicles inside. Ovarian cysts, big sac, different sizes of sac that can be growing. Now, this ovarian cyst may not necessarily have the same symptoms as PCOS, right? In order for you to understand truly what a cyst looks like, just imagine that you carry a balloon, you pour water inside. What that thing feels like, that thin wall, that's a cyst, right? It can contain different things, and I will explain that later. But before we understand all these two things, let's look at what happens every month. Every month, your body releases adverts. This month, Nkechi should get pregnant. And then different eggs apply for admission, including you that is watching this video. You applied for admission to become one side. Yes, you applied as an egg. Now, the body now starts to mature different eggs at different stages. All of you are rushing. But the body only picks like one or two. So all these other ones that were not fertilized or they did not mature, sometimes they close up, they resorb. Other times they don't, and they can form some of these small cysts. So when most ovarian cysts are quote and unquote functional cysts, right? They come and go with your cycle. They are harmless. You don't even notice that they are there. But there are some other cysts that you probably now need to pay attention to. There is one they call dermoid cyst. Remember I said if you pour water inside the balloon, what that thing looks like is a cyst. But sometimes it doesn't just contain fluid. There are some dermoid cysts that can contain skin. Sometimes it can contain hair. Another type of cyst is what we call cyst adenomas. It can be filled with something that is watery or feels like it's mucous material. Another one is endometriomas. It's linked to endometriosis, a condition that tissue that the internal lining of your womb now starts to grow outside the womb. These ones don't usually go away, and they need monitoring. You need to monitor them because it can actually be very painful and cause bleeding in that particular side. Now, let's not talk about ovarian cysts. There are some symptoms of ovarian cysts that once you see, you probably need to start paying attention to. Pain in the lower belly. Let me also tell you that pain is not a normal symptom. Some of you have gotten used to ignoring pain that's, depending on the size of the cyst, you can have bloating or feeling full every time. Depending on the position of the cyst, you can have pain during sex. Sometimes, some people are rushed to emergency, and that's how we know that they have cysts. The cyst, poof, inside, right? Another thing that cyst can also cause is when they can twist the ovary, called ovarian torsion, or they can burst. Remember the emergency that I talked about? They can rush to the hospital. It's a medical emergency, right? But remember, sometimes Ovarian cysts can form naturally during your menstrual cycle and go away on their own. But some things can make these ovarian cysts not go away. Hormonal imbalance, pregnancy, endometriosis, severe infections, especially the pelvic ones. Now, PCOS ovarian cysts. Let's look at it side by side. PCOS hormonal. The cysts are just a result of the hormonal problems, right? Cysts, physical growth. Sometimes under the influence of hormones, sometimes not. PCOS can affect your period, can affect your weight, can affect your fertility, can affect your mood, can affect your skin. Cyst will affect your ovary directly and will cause pain in large if it's big enough. PCOS might cause infertility. Cysts may not, depending on the position and size. PCOS might be linked to insulin resistance. Ovarian cyst by itself is not. In PCOS, the sacs are small follicles. In cyst, they are true cysts. So I hope by now you've understood that these things are two completely different conditions. But is it possible that somebody can have the two of them? Yes. Somebody can have PCOS and have an ovarian cyst on top. Those are two different conditions that need to be treated differently, like two different things. So how do you now know which one you have? Before a doctor actually tells you that you have PCOS, there are some things that they must do. They must do a blood test to check your hormone levels. They must do an ultrasound scan to look at your ovaries. They must also look about your symptoms, especially if your periods are irregular or if you're noticing certain things like excess growth, acne, weight changes. But to check for cysts, most doctors will just rely on a pelvic scan. This pelvic scan will show them whether there is a cyst, how big it is, the type of cyst it is, and then they can now decide to make an opinion. So you can see this is different from this. Now, how do you now treat both of them? For PCOS, there is no permanent cure yet, but it can be managed. I'll say it again. There is no permanent cure yet for PCOS, but hey, I'm at your car. There is no permanent cure for PCOS. S, not is. There's no permanent cure for PCOS, right? But you can manage it. And what some things you can do that can help you manage PCOS is losing your weight through healthy eating, exercise. This thing can make a really big difference. Sometimes even a small tiny weight loss can improve your symptoms. I've seen it happen. Just lose small weight, your periods are back to normal. Some things return back to normal. But you also need to understand that it is harder for people living with PCOS to lose weight, right? So you need to speak with a dietitian or a nutritionist or a coach to help you understand your body and choose the methods that best work for you. Number 2 is that there are hormonal birth control pills that can help regulate your period, right? And reduce the acne and hair growth. Those things have been given and work. There are also some medications that you will take to help you ovulate, especially if you're trying to get pregnant. There are some drugs that can help you use your body's insulin better. Because remember that we talked about PCOS and insulin resistance na collabo. Yes, they usually go hand in hand. So, Kechi, the reason we're making this video is so that you don't self-diagnose yourself. You don't just look at, this thing I've said looks like something I have, and then you now rush to the pharmacy just because you've heard some things and begin to ask certain drugs. Or you allow somebody who is a quack doctor to treat you because no. Remember I said there's a way to diagnose PCOS. If your doctor does not go through those ways to diagnose PCOS, quack. Now, your doctor has to advise you properly. For ovarian cysts, your doctor will mostly watch and wait, right? This is because some of them go away without treatment, like I said. But if the cyst is large or is painful or is looking somehow, your doctor might prescribe surgery to you to remove it. They don't used to use surgery to treat PCOS, but they use surgery to treat ovarian cysts. It's also very important that women in PCOS, especially if they're under the right treatment, can conceive. Yes, don't just put PCOS and infertility. No. Once you have undergo the right treatment, the right management, they can conceive. And many women with ovarian cysts will also face no fertility problems, except this cyst that is there is causing complications. So what should you do? Now, this is where we're now going to look at red flags to point out. Once you see any of these red flags, carry the banner and run to the hospital. Number 1 is when we're looking at ovarian cysts. If your period suddenly just stop bam, or become very regular. If you're having difficulty getting pregnant, right? If you feel pain or pressure in your lower belly, especially, yes, that does not go away, you start to notice sudden swelling, bloating, sharp pain, you need to pay attention. Or if you just feel like something isn't right, yes, sometimes your feeling is also, you need to ensure that your doctor is giving you reason enough to ensure that your feelings, I don't know if you understand what I'm saying, but I understand it, and I hope you do too. So if you don't feel right, ensure that your doctor gives you results or tests or something that ensures, right? Now, Nkechi, I want you to pay attention because I need you to listen here. This is not the place where you go and follow random online video and say, drink this tea and we are going to cure PCOS. That is not how it works. Or drink ovarian cyst cancelling tea. They're about to scam you. I'm telling you now, you need to go and check it out properly. You do not have a car problem and take it to Rafiu that is doing AC. If you have a car problem, you take it to a mechanic. If you have a carpenter problem, you take it to a carpenter. But when it comes to your body, some of you are taking problems that you need to take to carpenter, to the mechanic, and you're wondering why you're getting the results that you're getting. So if you have a health problem, you see a health professional. You don't see an online person that is selling tea. They are not health professionals. I will say it again, because your peace of mind is very important. And by the time you run around spending money with these carpenters that are disguising as mechanics, you're still going to come back to the doctor. So please, now that you know the difference between PCOS and ovarian cysts, you know that they are not the same. But both of them can cause problems, right? Don't suffer in silence. Talk to a doctor. Ask questions. The earlier you understand your body, the better the chances of protecting it. And I know that this video has actually helped you. Send it to somebody who you think would benefit from it. Just send, share. There's a link there. Share it to the person so the person can watch it too. Ah yes, before I forget. Sharp before I forget something. I asked you a question in the beginning. How many ovaries does a woman have? The correct answer is B, 2. So I lied to you when I said there's no right or wrong answer. There's wrong answer. There's wrong answer. If you get it wrong, we tell you get it wrong. Some of you that said 4, I don't know where you're keeping the remaining 2. Just know that the normal one is 2. One on the left, one on the right. If you carry the uterus, you are sitting beside. So this is it. So I can explain to you. You can see one on the left, one on the right. They are sitting beside the uterus. This is the uterus itself. And they take turns releasing eggs every month. This one release, this one release, this one release this month. Sometimes two of them can release at the same time. Yabeji, mama twins. Yes. So I know that I've given you too many knowledge, especially on this video. You're not going to agree, but I will tell you. You have facts now with knowledge. I've given you information that is supposed to empower you so that you can make better health decisions. Now, what am I asking for in return? Just like the video. Subscribe to the channel. It's there. Or you just say, hey, Aproko Doctor, you're doing such a wonderful work. People are giving me information that most of the people who are watching the video are not subscribed to it. It's not hard. Click subscribe. Click the bell button so that anytime we release a new video, it's not hard. That's how you can support us. Send to another person. Or you click my channel and watch other videos that you missed because you did not click the button that is supposed to notify you when new videos come out. New research is showing that people who watch my videos live longer. I don't know how we found out that one, but yes, do whatever you want to do with this information. Thank you very much.